At the Pennsylvania Health Access Network, we believe that advocacy is important in protecting vulnerable health programs. We've seen success in the past by bringing, hundreds of thousands of folks and their voices to discussions at the state and local level. We've seen policymakers switch their votes or switch their opinions from hearing from local constituents in their district that are impacted by these decisions. We bring together stakeholders that really push forward a proactive advocacy agenda, and we believe that, these continued efforts are important in making sure that all Pennsylvanians are able to maintain healthcare coverage and vital consumer protection.
PHAN is the only group that I know of in Pennsylvania that lifts consumers' voices around the issue of healthcare. So what does that mean? That means that if we need to make the case to a legislator that something needs to be fixed, PHAN will find the consumer who lives that reality and bring them to the legislator. Numbers don't have faces. If we can bring people to the lawmakers, if we can get their stories in the papers through either reported news or letters to the editor, then people, lawmakers and just people like you and me, can actually put a story and a face and an experience, a living experience, to the numbers that we hear thrown around constantly.
We work with a wide range of different folks. It can range from people who are homeless on the streets and they have mental and behavioral substance use disorders where they're trying to get better, they're trying to get into rehab. It also ranges to a lot of people who are working part-time jobs and because they're part-time, they're not offered health insurance. People who are self-employed, they have to pay for their own health insurance.
MHASP has been proud to be a partner with PHAN on several of the coalitions that they've brought together, including the Medicaid Expansion Coalition and the Housing is Health Coalition in Pennsylvania. Not only are we both committed to expanding health coverage and access in Pennsylvania, but we're also committed to doing that by amplifying the consumer voice in policy decision. We believe that good policy is only made when all voices are considered, and particularly the people who are impacted the most. In 2013, I remember working with PHAN to achieve Medicaid expansion for Pennsylvania, and this was critically important because it was going to impact health coverage of hundreds of thousands of Pennsylvanians. PHAN did an amazing job of bringing together consumers and advocacy partners from across the state to engage in rallies, in press conferences, in countless visits with legislators to talk about why health coverage matters to them. And because of PHAN convening those many groups of people and helping to mobilize them, we achieved Medicaid expansion in Pennsylvania.
Since my daughters were diagnosed with cancer, it's been really important to me to make sure that everyone has access to health care. The Pennsylvania Health Access Network has been a fantastic partner in trying to make that a reality for the people of Pennsylvania. PHAN does a fantastic job of telling healthcare stories, and thanks to PHAN, I've been able to share my story and to help others through the storytelling process.
I learned so much through PHAN. They gave me so much information. I had no idea about the expansion program at all. My healthcare has become a complete circle now. There's no stress, there's no anxiety. There's some of the things that I had when I didn't have healthcare. I absolutely feel like I need to give back. I think they've given me so much that I need to give back. And I'm one of these people that believe that if you don't know, you don't know. So, and if it takes just me as an individual to go out, which I've done, and say, look, this is an organization here. They can get you health care. They can help you. I spread the word. I spread the word as an individual. I think that knowledge is power. And so once you know it, there's no stopping you.
Consumers have always been the building blocks of our advocacy campaign. So as we were listening to folks over and over again, pre-existing conditions, folks being denied because they couldn't access treatment, or children not getting the care they need because they didn't have health insurance, helped us develop a policy platform to really advance policies to build healthcare reform.